My name is Hannah Cicero, and today I'll be teaching you about STDs. First, I'm going to start off with a short clip.
STDs are infections that can be passed during vaginal, anal, or oral sex. Some STDs are carried in semen, pre-cum, vaginal fluids, and blood. Others can be passed just from genital skin-to-skin contact. STDs are super common, and they usually don't show any symptoms, so lots of people don't even know they have one. The only way to be totally sure you won't get an STD is to never have any kind of sexual contact with another person. But the reality is most of us do have sex at some point in our lives. So the best way to help prevent STDs is to have safer sex. Safer sex means using condoms, female condoms, and dental dams every single time you have vaginal, anal, and oral sex. These barriers help block body fluids and some skin-to-skin contact that can spread STDs. Using barriers can even make sex better. When you're protected, you can relax and focus on each other instead of worrying about STDs. There are lots of different styles of condoms, and many are designed to increase pleasure. Adding water-based or silicone lubricant makes condoms feel great and helps stop them from breaking. You can get condoms and lube at most drug and convenience stores. If you have sex, get tested for STDs regularly, even if you always use condoms and feel totally fine. Testing is the only way to know for sure if you have an STD. It's usually quick, painless, and sometimes even free. STDs might seem scary, but most can be easily cured with medicine and don't cause any serious problems if treated early. And there are also treatments for STDs that can't be cured to help with symptoms and lower the chance of giving the infection to someone else. Having an STD is nothing to feel ashamed of, and it doesn't mean you're a bad person. The reality is STDs are super common, and most people get one at some point. People with STDs can be in relationships, have sex, and live totally normal lives. Want to learn more about STDs? Check out PlannedParenthood.org.
So, I picked this topic because everyone has sex at some point in their life, and sexual health is very important, and it affects others if you aren't healthy. So I'm going to start off with a few facts. Chlamydia and gonorrhea, which most of the time have no symptoms, can affect fertility. Condoms do not prevent 100% of protection from most common STDs. Example is genital herpes. Any sexual activity, not just intercourse, can spread STDs. So anal sex, oral sex, all of that stuff. Most people who have herpes have no or very mild symptoms. So this makes STDs very dangerous and sneaky, as most people don't have symptoms, so therefore they continue to pass it, and that's why it becomes a sneaky thing. Okay, so there's 7 the common STDs. Chlamydia and gonorrhea can lead to pelvic inflammatory disease. Hep C and B can damage your liver. Herpes can cause an outbreak of painful sores. You can get them in your genital area, around your mouth. HIV compromises immune function and can lead to AIDS. Syphilis begins with painless open sores, but eventually damages organs and can be fatal. So as you see, if these symptoms go undetected for long periods of time, they can have more severe symptoms on your body. Chlamydia is a very common STD. It is caused by a bacterial infection. It often doesn't have symptoms, and if symptoms do occur, it's usually pain or burning while peeing, pain during intercourse, lower belly pain, abdominal or vaginal discharge, or abnormal vaginal discharge, bleeding between periods, and swollen or tender testicles. So if you do experience symptoms, look for those things. It is easy to treat if diagnosed early. Herpes is a common STD that affects your mouth and genital region. It causes blistery sores, and this has no cure, but the symptoms are treatable. So you can take medicine that will make these symptoms more manageable and help decrease your risk for spreading. If you do experience symptoms, it would include burning when your pee touches a herpes sore, having trouble urinating because the sores are swollen or blocking your urethra, itching, pain around the genital area. If you have genital herpes caused by HSV2, you may have flu-like symptoms. So again, that could be thought of as just the flu and could be overlooked and be very dangerous. Okay, HIV and AIDS. As we know, if you get HIV, it can lead to AIDS after a long and severe course. HIV is an infection that breaks down your immune system and can lead to AIDS. No cure, but treatment can help you stay healthy. It can take up to 10 years for HIV to show symptoms. The first 2 to 4 weeks after being infected, you may experience. Okay, and lastly, for HIV and AIDS, treatment can lower or even stop your chances of spreading HIV to other people during sex. So this is definitely one that's very important to get treatment for. Syphilis is a common bacterial infection. It's easily cured by medicine, but can be very dangerous if not treated. Most people don't realize they have syphilis, and that is the main reason it is a very common disease that is spread. People can confuse symptoms with other things like pimples or rashes, which is also tricky. Symptoms can come and go over time, but that doesn't mean the infection actually went away. You still have it in your system. Syphilis can lead to serious problems and needs to be cured with antibiotics early. So this one's important to catch early so it doesn't cause further problems. Hepatitis B is a virus that can cause liver disease. It's spread through sex and sharing personal hygiene items, including razors and toothbrushes. So those are important to have your own, and obviously practice safe sex to prevent yourself from getting this one. Often has no symptoms or flu-like symptoms that can go unnoticed. If symptoms occur, they include feeling really tired, pain in your belly, losing your appetite, nausea, pain in your joints, vomiting, headaches, hives, dark-colored urine, and jaundice. When people show signs of syphilis, they usually show up between 6 weeks to 6 months after they get the virus. Gonorrhea is a common STD caused by bacterial infection. Often has no symptoms but is easily treated once diagnosed. If symptoms occur, they may include pain or burning while peeing, abnormal vaginal discharge, bleeding between periods, pain or swelling in the testes. So this is obviously like a recurring trend with the bacterial infection that is very easy to be treated if detected early and you get treatment. So that's very important. Okay, protection. It is the key here. You should use condoms, and birth control is important for protecting against pregnancy, but that is not protecting you from STDs. So you also need to use a condom or another form of protection. It is also important to ask your partner their sexual health or history, and then you can determine if they're healthy enough in their sexual activity. And it is important to know if they are getting tested as long as you are getting tested too. So it's important for both of you to be safe. Limit the number of sexual partners you have, because obviously the more number of partners you have, that increases your chance for getting an STD. Wash hands before and after intercourse. I think this one's very key for now in this time with the coronavirus. You should always be washing your hands before and after, and definitely limiting your partners during this time too. Get the vaccination for Hep B, and it is also very important to get tested for STDs. I would say at least every few months. It is very important to go. It's not, I feel like people get embarrassed sometimes about going, but it's very important, and it's something that everyone should do. I now have a second video to show you. This video is just showing a woman who finds sexual health very important, and she's just interacting with others, trying to figure out how much knowledge they have on sexual health, and then trying to educate them and show them the importance.
Have you considered the idea of getting STD tested?
I think I should.
Great place to meet guys, actually. In the waiting room.
Right.
They're responsible. They're proactive. I brought them some free smoothies to lure them into talking to me about ways that they can take care of their health. Free smoothies! They're normally like $12. Hi.
Hi.
Do you want a smoothie for free?
Sure. Which one's the healthiest?
I feel like everyone's really concerned about their health from like a food and exercise perspective, but like they're not taking care of their sexual health.
What do you mean by
Do you know what I'm talking about? Like getting STD tests? Do you take care of yourself?
Of course.
Yeah?
Yeah, you got it.
You get STD tested?
Yeah.
That's a lie.
I haven't.
You haven't?
No.
What percentage of people do you think get tested every year? 32.
I feel like maybe like 40.
Only 12%.
Oh my god, 12%.
Did you see what's on there?
Each year, there are 3.7 million new cases of chlamydia and gonorrhea. That's not good.
Chlamydia untreated can lead to infertility? Really?
Yes.
Whoa. That I did not know. You taught me something today.
Did you know that 1 in 2 sexually active adults get an STD by the time they're 25 years old?
Whoa.
I didn't know that either.
Yeah.
It's like a coin flip, basically.
Great.
And he's like, I gotta go make a phone call. Why do you think so few people get tested?
Maybe they're embarrassed.
People just think they're invincible. I guess people just don't think it's a big deal. It's like, but I find time to go to the gym. I eat healthy. I go to the dentist. But this is like my blind spot.
Not everybody shows signs. Like you can be a carrier or something. But
Right.
like, oh, I don't need to go. Like there's no reason.
Totally.
But like they
A
both
lot of them
show.
don't show symptoms.
Yeah.
You know? Which is why it's probably just good to get in the habit of it. Because right now I feel like there's still this like stigma attached to getting an STD test.
People don't want to be like, I'm sleeping around. I get tested, so I'm not worried about myself.
But when you said that, that sounded like sexy.
What?
You were like, I get tested. I'm like, damn, she respects herself. Like
Yeah.
that's an attractive quality.
Thank you.
Like I feel like we need to make this sexy.
At least before new people, like before you're dating new people, before and after.
I like that. It's like a reset. It's like sorbet between courses.
And I wasn't expecting this
Yeah, I feel like
topic.
we had such good chemistry, and then it just got weird.
I think it's something that I should do, and anybody that I'm with should do, definitely.
Yes means test.
Yes means
Yes
test.
means test.
You take those facts and you spread them. Don't spread anything else. Just the facts. Back in my day, you learned about STDs by getting one. You know.
Okay, so as shown in that video, the importance of getting tested and how many people, and how many new cases are discovered each year of chlamydia and gonorrhea. So if you're mature enough to have sex, you should be mature enough to go get yourself tested. It is very important for you and your partners. And like she said, it's like attractive and makes you more confident if you know you're clean and you know about your body, and this is important. Okay, so as we know, nothing can keep you 100% safe from getting an STD besides abstinence, which is completely refraining from any sexual activity at all. Okay, so if I were to be presenting to a crowd here, I would be doing this kind of uncomfortable activity, but I would want it to be private for each person. But so this is an exposure chart, and I'm just going to go through a few. So it goes based on the number of sexual partners you've had. So if you've had sex with one person, you're exposed to one person. And then we'll jump to 5. If you've had sex with 5 different people, you've been exposed to 31 people. If you've had sex with 8 people, you've been exposed to 255 people. And then the last number on here is 12. So if you had sex with 12 people, you've been exposed to over 4,095 people. So this is just kind of raising awareness to, you're not only having sex with the person you're being intimate with, you're having sex with all their past too. Especially if they're not getting tested, then you really don't know what's going on down there. So I think this is just like, it really opens up your eyes to see how many people you're actually being exposed to while partaking in sex. Okay, and testing, as I cannot express enough, it is so important to do every few months, especially if you're changing partners a lot. So you can get tested for females at your gynecologist appointments. And there's free testing sites all over. I know in Monroe County there's, I think, one on Main Street right here in Stroudsburg, and there's another location in Stroudsburg. They offer it during certain days. I think at our health center they offer it certain days during the month, and it's all free. So those are really good opportunities you should take advantage of. Yeah, and most colleges, for people who don't go to East Stroudsburg, do provide testing. So it's offered for you everywhere. You just have to like look around and find it, and most of it's usually free, which is really resourceful. Okay, and that's the end of my presentation. Thank you.